In the year 1987, Argentinian-born Dr. Julio Montaner joined the faculty at St. Paul's Hospital and UBC as the director of the AIDS Research Program and the Infectious Disease Clinic. Much has changed since then. Many lives have been saved because of Dr. Montaner's persistence and innovation. He's a passionate physician who is world-renowned for his HIV/AIDS research. He pioneered the HIV treatment as prevention strategy, and it is my pleasure to welcome Dr. Julio Montaner, Director at BC Center for Excellence in HIV/AIDS, to Studio 4, back to Studio 4 to tell us more once again.
Thank you, Fanny. Happy to be here.
Do you think we'll see in our lifetime the eradication of HIV/AIDS? Maybe in your lifetime?
I'm too old for that, I guess. If we're going to be realistic, I think we need to recognize that while we have a strategy that could actually control and possibly eliminate HIV without really having a cure and a very highly effective vaccine, true eradication may not be possible. However, we have made huge strides in controlling HIV, and BC has been showing the world how to do this.
BC?
Well, yes, BC, British Columbia. Some years ago, we started to study the potential for the cocktail, the so-called cocktail, highly active antiretroviral therapy, or HAART, which is, as you know, partly discovered here by our group in British Columbia, is the treatment that revolutionized the management of HIV disease. It transformed HIV infection into a chronic manageable condition. But what we became interested in is the potential for the treatment to stop HIV transmission. In other words, when you treat a person infected with HIV, you change the outcome for that person, but because you stop the replication of the virus, you shut down the virus, then the biological fluids, whether it's the semen or the cervicovaginal fluids, the blood for that matter, they become sterilized with regards to the HIV. And so we argued back then that the treatment could be the best way to prevent transmission.
And is it?
It is.
Are we there yet?
Yes, we are. The work that we have done here in British Columbia over the last decade has shown that when we expanded access to the treatment, let's say in the downtown east side, to people who are injecting drugs in the most difficult circumstances, we were able to dramatically decrease the HIV transmission in that neighborhood. And in fact, we have been able to decrease HIV new infections here in British Columbia by greater than 60%, and we are fully committed to decrease them as much as possible by bringing treatment to the people that need the treatment.
And the treatment is what exactly?
Well, it has changed dramatically as well over the last several years. In 1996, when we first came forward with the cocktail, it was a handful of pills. There were challenges, there were lifestyle compromises that you had to make in order to accommodate the cocktail. The cocktail became a full-time job.
I remember talking to Tico Kerr, famous artist.
Yes.
My friend, your friend.
Yeah, of course. Tico
about the routine of trying to stay alive.
It was very demanding. And I don't want to minimize the fact that taking medications is always demanding, but what it used to be a humongous task, multiple pills, multiple doses, multiple side effects, has now been simplified dramatically with cocktails that become now available as one dose per day. And in some instances, not all, but in some instances, we have options where the whole cocktail has been reformulated in one pill once a day. So really, taking the pill on a long-term basis becomes very doable.
So it's a pill, not an injection?
For a large number of people, is one pill once a day for the rest of your life. And if you do that consistently, you can derive a benefit from that pill for as long as you live. In fact, I often tell people what it was a short-term death related to HIV has now become a totally different outlook. A woman, 20 years old, that comes into the office diagnosed with HIV, back then we would say, look, your lifetime prognosis is very poor, you have no reproductive life ahead of you, this is bad, and we can only offer palliative therapy. Today we will say, your longevity is going to be fine, your reproductive life is going to be fine, your kid is going to be born without problems, your husband is going to be fine, you just hang on, take the pill once a day, stick with the program, and you will have a near normal life and you will see your children mature like you or me.
It's incredible. So a pregnant female with HIV on the cocktail, should we call it the cocktail or
Sure.
heart, on heart, can have a baby AIDS-free
Yes.
or HIV-free.
We have virtually eliminated HIV among the pediatric population, the newborns, in this province for now over 5 years. And the reason for that is that women who are HIV positive, who are pregnant, by taking the medication, they do not transmit the virus to their children. And let me just give you another piece of good news. Among heterosexual couples, a man and a woman, where one is positive and the other is negative, in other words, one is infected and the other one is not, if the infected member of that couple takes the cocktail, the likelihood of reducing transmission is greater than 95%.
Greater than 95%?
It doesn't get any better.
It doesn't get any better. Male to male, female to female, does it
Well,
matter?
the clinical trial, while it was open to heterosexual and homosexual couples, predominantly enrolled heterosexual couples. So we have the best data now for female to male or male to female. But the biology of it is so similar that really doesn't, it doesn't matter. We have data for injection drug users, for heterosexuals. So when you put the whole story together, this works everywhere we looked at.
I know you've made strides globally too. I know you've been to the White House, what, 2-3 times? Probably
Three
going
times.
back?
3 times, that's right.
What happens there? Have you met with the Hillary Clintons and the President Obamas, or
No,
perhaps
well,
one of their assistants?
We work with their team to try to get these issues on the table. And it's through their advisors that these things come to their attention. But I'm happy to tell you that in the last year alone, Hillary Clinton spoke very forcefully in support of this strategy that we have implemented in British Columbia now for a number of years, so-called treatment as prevention. And furthermore, President Obama on December 1st of last year made a specific call for treatment as prevention to be the centerpiece of the U.S. national and international strategy. We're very proud of that. I wish Stephen Harper would have the same courage.
And what's happening here?
Well, here in British Columbia, we have been blessed with a lot of support. The province has been incredibly supportive of our program, and I must say that if without that support, none of the progress that we have seen could have been accomplished.
Right, in BC, but in Canada,
federally,
not the case, or Alberta, New Brunswick, Ottawa?
You know, the AIDS has not been a priority in this country outside of British Columbia. Unfortunately, there is a reluctancy to attack this issue as a serious public health threat as it is.
And why? I mean, what's the downside?
You know, I think that there are issues of stigma, discrimination. It gets in people's psyche, and
Really?
And it's somehow the people are not comfortable. That they don't like the subject matter. They're you know, because let's face it. I mean, when you talk about HIV, then you need to talk about sexuality, and you need to talk about homosexuality, and you need to talk about prostitution, and then you need to talk about injection drug use and harm reduction, supervised injection sites. I mean, all of this is part of the mixture that we need to address if we're going to address this problem. And some of our politicians, federally particularly, are very uncomfortable talking about this.
We saw the resistance to the safe injection sites. Of course we did. But I can't imagine that there would be a resistance to a therapy or a prevention. It just doesn't make sense. It would save us money in the long run, right? How expensive is this therapy?
Well, I mean, the treatment is totally doable. I mean, it's, you're talking about $1,500 per month, roughly. So in the province of British Columbia, the government is happy to pay for it so that people can lead a normal life, pay their taxes, go back to work, support their family, and stop transmitting. So, you know, this is good for the person who is infected, this is good for their family, this is good for the public health effort, this is good for the economy. I mean, there are no downsides.
Well, and eradicating a disease makes sense, especially a disease that could kill you. TB, for instance.
Correct.
No resistance to stopping tuberculosis.
Right, but tuberculosis doesn't have even though there are socio-economical determinants of TB that we all are aware of, the issue about HIV is that there is the sex and the drugs, and you know, and for some people,
If you were just a better human,
that's right.
you wouldn't get that.
That's right. This is an obstacle for us to have a frank, honest, and productive discussion on how to control this problem.
And as you know, every one of us is vulnerable at some level, probably. I shouldn't say every one of us, but most of us.
Look, let's face it. At one time or another, we all have been sexually active, right? And so,
I
you know,
hope.
so you know, discriminating on people because they all of a sudden they had an infection, it's just not fair. I mean, you don't make a big fuss about people because they have, you know, venereal warts
or HPV
or
or
HPV,
other virus.
and you know why? Because people sort of are dissociating that from where it actually came from. Women are asked to have a pap smear, right,
Yes.
on a regular basis. The reason for that is because the HPV that they might have contracted may lead to cervical cancer. And we somehow have dissociated all of that, and we have been able to talk about that aspect of your health, the women's health, without problems. Well, this should be dealt in the same way.
Right, and sexually transmitted diseases are quite prevalent, as you know so well.
Of course, of course.
And it's not something you talk about at cocktail hour necessarily.
And you know,
but I'd almost venture to guess almost everyone has had one.
Maybe we should, because the more we normalize HIV, the more we're going to be able to control it.
Any links, HIV, HPV?
Well, yes, there are relationships in the sense that people with HIV, because it's a sexually transmitted disease, may have a higher tendency for HPV, and then HPV may more readily, if you are immune suppressed, lead to disease. But fortunately, we can control all of that with treatment.
How much of the sexually active population would have HPV? Human papillomavirus.
Now you got me.
Somebody told me 80%, and it was a somebody who probably wasn't a physician,
right.
but about 80% of us have it. It's silent. You don't know you have it.
Well, you see, that's the thing that is important to realize. HIV is a silent infection for the most part. So it takes at least a decade for HIV to become symptomatic.
A decade?
Right. So you can be infected with HIV for a decade, not knowing about it, not suspecting about it. So if you don't actually get offered the test and you don't think about it, then you're going to go around your network spreading HIV happily without really knowing what happened. And we need to stop that.
Right, of course. First day you're infected with HIV, first day. You don't know you are in a sexual relationship. Can you transmit immediately?
Oh,
when does that?
In fact, around the days and weeks after you contract the HIV, you are most vulnerable in terms of being able to transmit the virus, because the first phase of replication of the virus is very rapid and very effective. So there's a lot of virus circulating. So we're very worried about people who become infected and they move on from one partner to the next, and then the next partner, the likelihood of infecting the next partner is very, very high.
Question then is, who should be tested? Let's take a break, and when we come back, we'll get the answer.
Yes, we will.
Okay, Dr. Julio Montaner, our guest director for the BC Centre for Excellence in HIV/AIDS, 20 years old last week.
Correct.
Yeah.